Human immunodeficiency virus, HIV, the virus that causes acquired immunodeficiency syndrome, AIDS, has been a challenge to the fields of medicine and public health worldwide since its emergence, causing immense suffering and claiming millions of lives. So, how does HIV spread? How does it cause such terrible complications? And where are we now with treatment? Hey everyone, my name is Dr. Graham Dersnah. Welcome back to my channel, where we discuss topics related to obstetrics, gynecology, and sexual health. If you find value in these videos, I encourage you to subscribe, like the video, and leave a comment. Human immunodeficiency virus, HIV, is an infection that attacks the body's immune system. By infecting and ultimately destroying these cells, HIV weakens the immune system, leaving the body vulnerable to opportunistic infections and cancers. The impact of HIV/AIDS extends far beyond medicine. It has profound social, economic, and psychological implications, disproportionately affecting marginalized communities and exacerbating existing inequalities. Stigma and discrimination against those living with HIV leads to persistent barriers to prevention, treatment, and care, hindering efforts to control this epidemic. There is so much to learn and discuss regarding HIV. Let's jump right in and start learning. What is HIV? The infection that we call HIV is caused by a virus named the human immunodeficiency virus. There are two types, HIV-1 and HIV-2. There are also subtypes and uncommon variants. HIV is part of the virus family called retroviruses. These viruses are so powerful and difficult to treat because of how they infect and replicate. After infecting an immune cell, HIV uses a special enzyme to integrate its genetic material into the cell's DNA. The cell then performs its usual cell division process, but now also replicates the virus DNA to produce more copies. These new virus copies then break out of the cell to infect new cells and repeat the process. How is HIV transmitted? HIV is transmitted from one person to another through contact with bodily fluids, including blood, semen, pre-seminal fluid, vaginal fluids, rectal fluids, and breast milk. It can be transmitted during oral, vaginal, or anal sex, during pregnancy and delivery, breastfeeding, sharing needles for injecting drugs, tattooing, and by getting accidentally stuck by a needle. For example, a healthcare provider performing surgery on someone with HIV. It cannot be transmitted through casual contact, such as hugging or shaking hands, and it cannot be spread by contact with objects, such as toilet seats and doorknobs. HIV does not spread through air, water, or by insects. Risk factors. Risk factors for contracting HIV include unprotected sexual contact, having other sexually transmitted infections at the time of sexual contact, sharing needles, alcohol and drug use that may alter your decision-making ability regarding safe-sex contact, blood transfusions, tissue transplants, and accidental needle stick injuries. What are the symptoms and long-term complications? HIV has several stages, each with a unique presentation. The first stage occurs within several weeks of infection and may last several weeks. It is called the acute phase and causes symptoms similar to the flu, such as fever, fatigue, rash, sore throat, and swollen lymph nodes. Most people experience symptoms, but it is possible to be asymptomatic. The infection then becomes chronic and may appear to be dormant for several years, but it is slowly destroying the immune cells of the body. Eventually, the immune system becomes so weak that it cannot prevent other infections and infection-related cancers that typically we can fight. These are called opportunistic infections. At this point, the person would be diagnosed with AIDS, acquired immunodeficiency syndrome, and without treatment would likely die shortly thereafter. There is currently no cure for HIV, so once infected, you will remain infected for life, but treatment will help manage it. There are two values that are regularly monitored to determine if treatment is working well. The first is called the CD4 count, which is the number of immune cells in the body. The second is viral load, which is the number of HIV virus copies in the body. There are numerous medications used to treat HIV. Each class of medication targets HIV in a different way. For example, one attempts to stop the virus from infecting the immune cells, while another can stop it from integrating its genetic material into the cell's DNA. Most treatment plans involve taking 2 or more medications together. The goal is to suppress HIV and reduce the viral load until it is called undetectable, which means there is not enough virus in the blood to be recognized by the blood test. This will allow the CD4 count to remain at a normal level. For people without HIV, reduce your exposure to the risk factors. Use condoms with every sexual encounter and avoid needle sharing. You can also use medication called pre-exposure prophylaxis, which we'll learn about in a later video. For people with HIV, other than reducing exposure to the risk factors with uninfected people, continue treatment until you're undetectable. At that point, it has been shown that HIV cannot be transmitted. In the upcoming videos, we'll learn about the U=U campaign, and we'll explore HIV as it relates to pregnancy. By working together, we can create a future where HIV/AIDS is no longer a global health threat. Thanks for watching. Now hit that subscribe button and like the video. Then check out this other video to keep learning.